have GPs that have the time to do those comprehensive reports that are required by the Commission, or, they don't have the time to fill out all that documentation. So under the model that we've got for providers, it's particularly beneficial for the compliance. So Georgia really maintains those conversations with the families and really does live education with them around the benefits of any particular medication, chemical restraint, when they're going into palliation. I would say, Georgia, you go above and beyond your role where you are at the moment, and it's really evident that the residents and the facility, they're just so happy and they're well cared for, and the documentation is just it's very, very comprehensive, a lot more comprehensive than I think what you would get if you had a 3-minute visit from a GP. And it's not from any fault of their own, it's just there's just not enough resources out there for rural and remote GPs to be able to spend the time to do what's required to meet those governance expectations. So under this model, if there is a rural and remote provider out there that's really struggling, we'd love to hear from you, and we'd love to have a chat and talk you through how we can support you. With this model, Georgia flies in once a month and she sees about 20 clients in that particular day. Is that correct, Georgia? Yeah.
Yeah.
And then she flies back on that same day. And then in between, we have what's called telehealth. So telehealth once a week at a set time. So there's that continuity of care. So they're getting that weekly touch point in between every on-site visit. And in terms of the costs and things like that, it's really the travel that's not funded. So as Georgia was saying, Medicare covers a lot of her requirements and reviews with the residents, but the travel is not covered by any funding stream. So this is where we're really pushing with the government to get some models of care and some funding and resourcing for the travel, because it's really the provider has to pay for that travel. That's where a lot of the cost comes in.
That's really interesting. I think one of the things I wanted to touch on in there is I want to bring it back to something quite personal in that, and for both of you to speak to. But we're talking about the model of care, about the data, about the policy and the workforce numbers. But behind every one of those statistics is a family. And what's the story that stays with you? The one that made you realize the system needed to change, or gave you that passion to take this on every week and every day.
Is that you want Georgia, or who are you wanting to answer that?
Both of you. You both play a vital role in this. So I'm sure you both have I call it the why. What is your why, or what's the story, the human moment in this too? Because at the core of all this, we do this for something special, something that drives us to get out of bed and look at this job and look at this industry in a different way, in a different light, and to make it better, make aged care better, but also think about those humans that you've really, really had an impact on. Or share some of those stories over the years, because I'm sure you have a few of them. Probably write a book, right, Sherrie?
Yes, that's true. Look, I guess, Georgia, if you're happy for me to chip in first, I don't know, you've probably got some wonderful things to say as well, because I have heard quite a few beautiful stories and we've had quite a few conversations, but as to why we're doing this. But I guess my passion is innovation. I love to be able to give back to the community in different ways, because aged care is really struggling out there in terms of where everybody is at to try and make compliance, and I think innovation's the key. But also not, having that passion. I've got a real passion for aged care, and I think that I'm not sure if I was born with it, but for whatever reason, I love working in aged care, and I always have. So even when I was in university, I think I wanted to work in aged care. Straight after my grad year, I went into aged care. It just for me, it's been my passion and my love. And I'm particularly fond of rural and remote, and feel like if we can support them in any way possible with innovative, cost-effective ways I think that's what it's all about. So that's where my drive is.
Georgia, would love to hear your why as well.
Yeah, there's lots of whys. I think, when Sherrie first approached me, obviously I have a young family and it's a long way away from home. But I think just going that first day to that facility out in Corindi and just meeting the residents and just seeing the smiles on their faces, they're just really lovely, down-to-earth people that have just had a great life, and then were so thankful that somebody was there and willing to take time to talk to them about their health and whatever it might be, the family situations that they're in, or just some beautiful stories of their life, just someone to take the time to sit with them and care about them. So I think that was really the why for me, in that just even a very small change in their healthcare can make a big difference to them as a person. And I mean, across the board in my nursing career, I always wanted to go into nursing. My mum's a nurse. But I was the same sort of as Sherrie in that I was always drawn to aged care. I just find the older population so much more interesting, and medically as well, I think they're more complex, which, is often a bit of a debate with my medical peers who go into pediatrics and adults and surgical and things like that. But the older people with so many potential comorbidities, it's just like a big puzzle to me. So I like that element of it too.
No, I love that. And is Corindi the name of the location or provider?
Corindi is a town.
Okay.
It's about 50 minutes from a drive from Tamworth. And the nursing home is called Corindi Care Services.
Okay, so they're a standalone?
They're part of Apollo Care now.
Oh, of course I know that. Yeah, that's why it rings a bell. Yeah, we've had Stephen Becci on here, and I've had him on the podcast. At this point, he's pretty much a friend. I've spoken to him so much and caught up with him a bunch of times. But I love their model. So good on you for supporting them. Rob just messaged saying he's about to board his plane, so he's going back to Sydney. He's getting on there, so he's logged off. But we can carry on. He did put in a question, but before we ask his question, Kim Davis, friendly face of the show, asked a question about the model that you described. Would that model work in home care support at home as well?
I can't see why it wouldn't, Georgia. I mean, going to a resident's aged care facility is no different to going to their home. Is that correct?
Yeah, it definitely could work. It's just getting the volume of work from, for a nurse practitioner. Obviously, there's not a lot of home visiting GPs, and for those clients that are pretty housebound and find it difficult to get out to see their GP, nurse practitioners coming into the home is a really workable model, but it's just for that model to work, there would need to be some degree of sort of volume for them.
And the other thing too, Anthony, it's the funding stream. So it's the travel time. So if you're seeing somebody in their home and you might live in Sydney Metro and they're 2 hours away, you've got a 2-hour drive that's unfunded through Medicare. And then you've got to see the client that is funded through Medicare, but then you've got to get home again or you've got to go somewhere else. So it is really the travel component that, because it's not funded by any income stream under the government, there's just no funding for it at the moment. So, we really want to be able to support, home care and residential aged care, but the cost of sending somebody out, like Georgia said, the volume of residents, it can be quite challenging from that perspective.
So who do we have to talk to about that?
Well, we've been advocating it at the moment through the budget in the federal budget, so that we can get a bit of exposure for the nurse practitioners, and really trying to get even some pilot programs out there to see how this could work in the home care setting, because I think that's very, very important. With residential, you have residents clustered together, so the volume is already there. But at home, that's certainly a big concern.
Is there a particular person that you'd want to sit in front of and talk to about that?
I think, well, obviously you would be starting with the health minister to begin with, and I'm sure that somebody here out there is actually watching this. Will definitely pass this conversation on to them, no doubt.
So if you say, I think there's this new AI feature on this platform. So if we say the words "clip that" later, there after this is done, it'll produce a little clip, and then you can share whatever you want that particular section on your social media. So we're going to try that. We're going to try. Maybe I'll get you to put a few words to whoever it is, and then we'll say "clip that," and then we'll send it to you. We'll spam. Everyone will spam their LinkedIn with that particular video. But relevant question from Miras Australia here. So if you could sit in front of the Minister for Aged Care today, not for a photo opportunity, not for a press release, but for a real unfiltered conversation, what's the one thing you would ask them? Both of you need to answer this. Oh, wait. There's a second part of the question. What's the one thing you would ask them to do differently? So I guess you could. So what's the one thing you can ask them, or what's the one thing you would ask them to do differently? Either or.
I'd probably ask them to look at the nurse practitioner items within the MBS and see how they could do those differently and make it more equitable to a GP's assessments in an aged care context.
Yep. Clip that. See if it works.
I would like to see some sort of a subsidy for aged care providers who are in rural and remote, who are struggling with GPs. So, if they were to implement a nurse practitioner model of care, it would be great if there was a grant or an opportunity to support that model, because the provider does have to pay for the travel and any nurse practitioner fees that may be there for that day visit. And if there was an opportunity to get a subsidy or some sort of an incentive to make that model more equitable for rural and remote providers, particularly those who are very small, like 30 beds, 40 beds, who are really struggling, really hurting, that would be great. If there was some sort of financial subsidy applied for them, that would be fantastic to offset the cost of the fly in and the fly out.
And clip that. Okay, this I want to show you a little bit. I want to show you a post of your fellow nurse practitioner. Do you know Prosper Bamford? She's I met her at the Positive Aging Summit last year, and I've been following her. She's been following me for some time, and she's probably the first nurse practitioner in aged care that I got to know. And she posted this 3 weeks ago, but I only saw it yesterday. And I just want to give her a shout out to congratulate her for being selected to receive a place on the Florence Nightingale Foundation Leadership Scholarship. So congrats, Prosper. I thought it'd be a apt time to give you a shout out, seeing as this whole thing is about nurse practitioners and what you guys do for the sector. So she's a big advocate for aged care, and she's doing the best she can. And I look forward to catching up with her in Adelaide in a couple of months. I have asked her to be on, but she's pretty full on at the moment. For those who are tuning in right now, we've discussed the nurse practitioner model as it pertains to aged care, talked about the career pathways, I mentioned at the beginning, I have been engaged by a client to look for a nurse practitioner to join the organization on a permanent full-time basis. It's not an easy role to fill, and that's why they came to me. And this is the sort of platform, and it's just perfect timing that we had you two as guests today. So hopefully people in your network are watching this, and we can clip that and send that around to them as well. What, in terms of numbers, do you know the figures as to how many nurse practitioners there are in Australia, or how many work in aged care?
Not off the top of my head.
I think I saw the number. I could be wrong, but I saw the number 3,000 somewhere, or maybe that could be.
I think there's I think the last estimate was like 2,800 or something in Australia, which is really not a lot at all.
No.
But I'm not sure how many in aged care. You could probably easily look that up. But
yeah. So yeah, and not a huge not a huge pool of talent to choose from. And hopefully we can get a good number of those nurse practitioners to consider aged care. Now, there was a question when you talked about the nurse advisory, where I guess I wonder who chose when there's when remediation needs to occur, who chooses which nurse advisor that goes? Is it the commissioner or is it the aged care provider?
The aged care provider, if chooses who the nurse advisor is, and depending on what the regulatory action is, they need to report that to the commission, and then the commission would need to approve that nurse advisor.
Okay. I've got some questions around that because I'm still figuring out how that all works, but I'm not sure if I know how to articulate them so well right now. We're live, so I'm not going to try. I'm going to think about that for a little bit and come back to you maybe offline and pick your brain on it a little bit more. But if anyone else out there has a question about how it all works, please send the questions through so that I can continue learning about it as well. Is there anything that we haven't covered yet? Was there anything that you wanted to touch on today?
I think we've covered it pretty well, haven't we, Georgia, in terms of what we do and how we do it. I'd like to say that, it probably took about 6 months to really establish this model of care, to make sure it was running smoothly, because we did hit a few road bumps along the way in terms of things like EPC referrals. We certainly found that out along the way, where, that can only be a GP that actually refers for the EPC. So that was a barrier that we had to work through, quite a significant barrier. But we have managed to work through some of those things, as well as the death certificates as well. So we found solutions to some of those little roadblocks that we had in the earlier days, haven't we, Georgia? And I think it's running very smoothly now. There hasn't really been any, it's just ticking along, isn't it, really?
Yeah.
Well, great. Lexi Methrol, she was actually backstage before, but I think maybe she couldn't get her camera working.
She is here. She's asked a question.
Yeah, so she says, in support of what you said, need to be doing more to support nurse practitioner-led models like Sherrie and George's in aged care and everywhere. So shout out from Lexi to your model.
Thank you,
to anyone wanting to reach out to you guys, you want to plug your contact details so they can reach out to you to talk more about this? Email address maybe would be safest rather than your personal phone number.
Sherrie?
Social accounts.
Of course.
I heard the term. He said you can follow me on Twitter. You can follow me on.
I don't think links. We have a
follow me.
we don't have a handle on LinkedIn. But yeah, if anyone wants to reach out to either Sherrie or Georgia, just follow them on LinkedIn. Send them a connection request.
Yeah, that's probably the best way.
Yeah,
definitely.
Sorry to put you on the spot and tell you to put on blast your contact details. I'm a recruiter. I'm used to asking for those sort of things, but yeah, maybe not in a public forum. Rob is still online. Rob, I think we're ready to wrap this up. If there's anything else, any other questions, any other comments from anyone, including yourself, Rob, do you have any more thoughts to throw out to Sherrie and Georgia?
Just wanted to I just want to say, thank you to both of you for what you do in this industry, and you play such a vital role in it. So keep doing what you do, and we'll keep doing what we do, and we will continue to make aged care better.
Awesome.
Right.
Thank you, Rob.
Thank you very much.
Thanks, guys. Play us out, Rob. I don't know if you can from the play, but I guess we'll say goodbye there. Catch you all next week.
Awesome. Thank you.
See ya.
Bye-bye.